the leading cause of death worldwide, is preventable. Cardiovascular disease, including heart attacks and strokes, is linked to common risk factors such as cholesterol, smoking, and high blood pressure. And these risk factors interact together, meaning the more risk factors you have, the higher your risk, or the more likely you are to have a heart attack or stroke. The good news is, with appropriate screening, we can identify people at high risk and manage their risk factors through lifestyle changes and medications, which is why treatment guidelines recommend that GPs look at all risk factors. So why does this happen in less than 30% of patients, potentially leaving people with multiple risk factors at high risk, or unnecessarily giving lifelong treatment to people for single risk factors? My PhD aims to address this gap using digital technology to add value to an existing and heavily used healthcare setting at pathology services. The first part of my PhD focused on working with the healthcare industry to develop a solution by interviewing 15 GPs and working with stakeholders that appropriately addressed the barriers faced by GPs, the current treatment guidelines, and previous research findings. The service I have developed offers patients attending pathology services for a cholesterol test a detailed cardiovascular risk assessment. After their blood sample is taken, patients are guided to a booth where they can complete an app, and this app collects simple risk factor information via a questionnaire and then measuring blood pressure. This information is then sent to the pathology lab, matched with the patient's cholesterol results, and used to work out their risk of heart attack and stroke. This result, along with the recommended treatment for the patient's level of risk, is sent directly to their GP after it is added to the blood test report. The next part of my PhD focuses on that all-important, does this actually work? So to do this, I'm testing it in practice at one pathology site with 300 patients, and I'm looking at two things. Firstly, I evaluate the patient experience of the risk assessment directly after they have completed the app using a mixed methods questionnaire, meaning some answers are yes and no or fixed, while others are open to give a rich insight into the patient experience. Next, I look at the GP response to the blood test report by calling patients at 1 month, 3 months, and 6 months and comparing their treatment to current guidelines. Ultimately, I hope this simple solution results in avoidable heart attacks and strokes being prevented. Thank you.